You know what the scariest part of human history is? It's not the wars, the famines, or the natural disasters. It's the fact that some of the dumbest decisions ever made were confidently recommended by the smartest people in the room. These weren't fringe ideas whispered in dark corners. Doctors, actual medical professionals who were trusted with human lives, endorsed these treatments with the same certainty you'd expect from someone describing gravity. Moment 1. In the 1800s, doctors believed that bloodletting could cure literally everything. A fever? Drain some blood. Broken leg? Drain some blood. Sadness? You guessed it. The logic was so backwards it actually worked sometimes, but only by accident. Patients who survived were the ones who weren't sick enough to die anyway. Moment 2. Mercury was considered a cure-all. Doctors prescribed it for syphilis, skin conditions, and basically any disease they couldn't explain. The side effect was that mercury is poisonous, so patients either recovered from their original illness or died from the treatment. Win-win in their minds. Moment 3. Lobotomies were performed on thousands of people as a solution for mental illness. Doctors literally drilled into people's skulls and severed brain tissue. The success rate was measured by how docile patients became after destroying their personalities. This was considered modern medicine. Moment 4. Radium was added to everything. Water, makeup, suppositories, toothpaste. People were told it was energizing and healthy. Turns out radiation causes cancer. Doctors seemed shocked by this development, despite radiation literally being radioactive. Moment 5. Tobacco smoke enemas were used to treat patients with hernias and digestion problems. Doctors would literally blow smoke up patients' anuses through a tube. Somehow, this didn't fix anything. And now we also know that tobacco is bad. 2 lessons for the price of 1. Moment 6. Bloodletting for yellow fever. During epidemics, doctors would drain patients of massive amounts of blood while they were already dying from a disease that causes internal bleeding. It's hard to imagine a worse treatment, but somehow they managed it. 7. Arsenic compounds were prescribed for skin conditions and syphilis. Yes, arsenic, the same poison used to kill rats and enemies. Doctors really said, what if we poisoned the patient slower? Shockingly, this also had bad outcomes. Moment 8. Lobotomies were performed on children. The youngest patient was 5 years old, a 5-year-old, for behavioral issues. This wasn't hidden away. It was celebrated in medical journals. The acceptance of this speaks to how broken the entire system was. Moment 9. Doctors recommended straitjackets as a treatment for insanity. Just restrain someone completely and call it medicine. Imagine being confused and then being immobilized further. What could possibly go wrong? Moment 10. Leech therapy was used for almost every problem. Doctors would apply leeches to patients' skin to balance humors. People died from blood loss caused by creatures that eat blood. The irony was lost on them. Moment 11. Trepanation, drilling holes in the skull, was used for headaches. Doctors thought that making the headache literally physical would somehow cure it. The fact that this sometimes resulted in infection and death didn't really slow them down. Moment 12. Ice water baths were recommended for fever patients. Let's ignore that the body is already trying to regulate temperature and just plunge people into freezing water. Many patients developed pneumonia and shock from this treatment. Moment 13. Opium was prescribed for everything, including colic in infants. Doctors casually addicted children to one of the most addictive substances ever created. When babies became dependent and suffered withdrawal, doctors just prescribed more opium. Moment 14. Mercury was used as a contraceptive. Spoiler alert, it doesn't work. What it does do is cause permanent damage to the reproductive system, neurological damage, and death. But sure, the contraception aspect was totally the problem doctors were solving. Moment 15. Doctors performed craniotomies to reduce skull size, based on the belief that this would improve intelligence. They were literally shrinking people's skulls for pseudoscience. The patients didn't become smarter. They became brain damaged. Moment 16. Bloodletting was used to treat strokes. A person's brain is bleeding, so let's drain blood from their body. This somehow made the bleeding worse. Medical logic at its finest. Moment 17. Calomel, a mercury compound, was used as a laxative for children for decades. It poisoned children's intestines while also poisoning them systemically. The medical establishment knew it was toxic but kept recommending it anyway. Moment 18. Electric shock was used to treat depression. Not in the way we might use it now with careful monitoring. Doctors would just shock patients until they stopped complaining. The assumption was that pain would somehow cure sadness. Moment 19. Syphilis was treated by intentionally infecting patients with malaria. The fever from malaria was believed to kill the syphilis. Some patients did recover from syphilis, but then they had malaria. Doctors considered this a win. Moment 20. Tobacco enemas returned. This time for constipation. Instead of blowing smoke up people's butts, doctors would make a tobacco paste and stuff it up there. The nicotine was supposed to stimulate the bowels. It mostly stimulated vomiting and organ damage. Moment 21. Doctors prescribed radioactive suppositories for hemorrhoids. The idea was that radiation would reduce inflammation. The reality was radiation exposure in extremely sensitive areas. At least patients who survived got a legitimate excuse to be angry about their medical care. Moment 22. Bloodletting was used for pneumonia. A patient struggling to breathe because their lungs are filled with fluid. Let's drain their blood. The logic here is so broken that it wraps back around and becomes pure evil. Moment 23. Doctors performed frontal lobe surgery on people with severe acne. Acne. They drilled into brains and cut tissue for a skin condition. The acne didn't disappear, but the patient's entire personalities did, so I guess that's one less problem. Moment 24. Lead compounds were used to treat gout. Doctors knew lead was toxic. They'd seen lead poisoning before, but somehow thought it would help with joint pain. It helped by causing paralysis and organ failure, which technically overshadowed the gout. Moment 25. Bloodletting for appendicitis. A person's appendix is bursting, causing internal bleeding and poisoning. So naturally, drain more blood. The patient would either die from the infection or bleed to death. The doctor got paid either way. Moment 26. Doctors performed hysterectomies on women for hysteria. They were removing the uterus because they believed that women's reproductive organs were causing emotional problems. Thousands of women were permanently sterilized for what was basically just regular sadness or stress. Moment 27. Mercury salts were injected directly into patients for syphilis. This was an escalation from just feeding them mercury. Injecting mercury into the bloodstream caused acute poisoning, but doctors called it treatment. Moment 28. Doctors recommended bloodletting during childbirth. A woman was already losing blood and needed every drop, so naturally the solution was to drain more. Maternal mortality skyrocketed when doctors started using this method. Moment 29. Arsenic was used in treatments for anemia. You need more iron in your blood, so let's give you poison instead. The logic doesn't even pretend to make sense here. This was just desperation masked as medicine. Moment 30. Lobotomies were performed on teenage girls for what we would now recognize as normal adolescent behavior. Teenagers were moody, so doctors drilled into their brains. The procedure was so widely accepted that it was performed in schools. Moment 31. Bloodletting for cancer. Because if the problem is abnormal growth, the solution is definitely to weaken the entire body by draining blood. Patients died faster, so at least they were out of their misery quicker. Moment 32. Cocaine was used as a local anesthetic, and then doctors realized it was addictive and started giving it to literally everyone. It was in eardrops, eye drops, and dental treatments. Addiction rates skyrocketed, and doctors acted surprised. Moment 33. Doctors performed mastectomies on women with breast pain. Instead of investigating the actual cause of the pain, surgeons just removed the breast. Many women died from complications, and their pain never actually went away. Moment 34. Mercury compounds were used to treat constipation. Poisoning the digestive system to make it work better was somehow the logic here. Patients experienced violent purging, dehydration, and systemic poisoning. Success. Moment 35. Doctors performed trepanation on infants for developmental delays. A baby isn't developing normally, so let's drill a hole in their skull. Even by the standards of the time, this was inexcusably stupid. Moment 36. Bloodletting for madness. A person is experiencing mental distress, so the solution is to make them physically weak and dizzy. Somehow destroying the body didn't cure the mind. Doctors remained baffled. Moment 37. Radium suppositories were used for prostate problems. Doctors inserted radioactive material directly into sensitive tissue. Patients developed radiation sickness and cancers. The original problem was almost forgotten in the face of new radiation-induced problems. Moment 38. Doctors recommended feeding mercury to children with ringworm. A fungal infection on the skin? Give the kid a heavy metal poison. Childhood mercury poisoning became common, and doctors just accepted it as a side effect. Moment 39. Bloodletting was used to treat hemorrhage. A person is bleeding to death, so let's drain more blood. This might be the peak of medical stupidity. It's so dumb that it almost feels like a joke, except people actually died. Moment 40. Doctors performed multiple lobotomies on patients who survived the first one. If drilling into someone's brain once didn't cure them, surely doing it again would. Some people had 3, 4, even 5 lobotomy procedures. Moment 41. Mercury was mixed into teething powders for babies. Infants were being poisoned while their teeth came in. Neurological damage became common in children, and parents had no idea why. Moment 42. Doctors used bloodletting as a treatment for miscarriage. A woman's body was already in crisis, so the solution was to weaken it further by draining blood. Maternal death rates from this treatment were catastrophically high. Moment 43. And finally, doctors prescribed bloodletting for basically every single illness at the same time. The 1800s were the era when a person could walk into a doctor's office with any complaint and walk out with fewer blood cells and a lighter wallet. Some people were bled so many times that they developed anemia from the treatment itself. The circular logic, treat the disease caused by treating the disease, seemed to escape everyone in the medical profession. Here's what's genuinely terrifying about all of this. Every single one of these treatments was recommended by educated professionals. They weren't performed in basements by quacks. They were performed in hospitals, in universities, by people who were considered the brightest minds of their era. They had credentials, respect, and authority, and they confidently, systematically harmed millions of people based on ideas that were completely wrong. The scariest part isn't that these treatments failed. It's that they failed consistently, and the medical establishment kept recommending them anyway. That takes a special kind of confidence. The kind that comes from being absolutely certain you're right while being absolutely wrong.